Hello, this is Dr. Grant Cooper from Princeton Spine and Joint Center. In this video, we are going to discuss everything you need to know about hip pain, all in the next 12 minutes or so. So, no time to waste. Let's get started. Now, luckily, hip pain is relatively simple to understand. That doesn't mean that fixing hip problems is always easy, but it does mean that we can usually figure out what's going on and discuss the treatment options and expectations of those options with some high degree of confidence. There are three main causes of hip pain. The most common cause of hip pain is hip osteoarthritis. Hip osteoarthritis is more common as we age, but even people as young as 40 or younger can have significant arthritis in their hips. This is especially true in people who have used their hips a lot in their lives. So for example, dancers, runners, other athletes who put their hips through a lot of pounding and or rotation. I'm looking at you, baseball catchers, in their sport. Now these activities are great, by the way. My wife and I did sports, our kids do sports, but there's sometimes the piper to pay on the back end of all that fun. The best way to prevent hip issues, as with other joint issues, is by taking great care of our joints before, during, and after sports. So, arthritis is the most common cause as we age. Osteoarthritis is a loss of cartilage in the joint. Now, cartilage is like a sponge that holds your joint fluid in the joint. When you're not moving, the sponge is at rest. When you get up and you start moving the hip, the sponge is squeezed, right? You squeeze the sponge and the joint fluid that was in the sponge is released to bathe, lubricate, and ultimately protect your hip joint. As you lose your cartilage, you also lose the joint fluid. And then there's a cascade of compensatory reactions that take place in and around the joint, including things like the formation of bone spurs, bone cysts, and all of these things can then lead to inflammation and pain. The second most common cause of hip pain is a labral tear. The labrum is the lining of the hip joint. It's actually a specialized cartilage that runs along the rim of the socket of the hip joint and adds stability and shock absorbing capacity to the joint. And just like other pieces of cartilage, the hip labrum can tear and become inflamed and painful. It's extremely important to realize that you can have severe hip osteoarthritis and you can have a large hip labral tear and you can have no symptoms. This comes as a surprise to a lot of patients and doctors alike, and at first blush, this is understandable why it would be surprising. But consider the following. In a person who is over 60, there's almost always going to be hip osteoarthritis seen on an MRI or X-ray. So this is to the point where if you got an MRI of, let's say, a 60-year-old's hip and there's no osteoarthritis, this would be much more notable than if there was at least mild osteoarthritis on the MRI. But most people who are 60 or older don't necessarily have hip pain. Right? A dancer or football player often has labral tears that you can see on an MRI when in fact they have no hip pain, and the finding is just an incidental one, or one done in a study. Now, the reason these things cause pain or don't is if there's an inflammatory reaction to the anatomical change. If there's inflammation, there'll be pain. If there's no inflammation, there won't be pain. One exception can be if the joint has completely worn away, and then you get the grinding of the bones that can cause pain. But even then, it's really the inflammatory reaction that results from the mechanical grinding, as opposed to the mere grinding itself that the person will then perceive as painful. And the third most common cause of hip pain is tendinitis. As a quick basic review, muscles attach to bones via tendons. If these tendons become inflamed, we call that tendinitis. Itis being the Latin suffix for inflammation. Now, the powerful hip flexor tendon that runs in front of the hip joint is chronically tight in most people these days from all the sitting that we all do all day. This is a tendon that often becomes inflamed from the extra stress from chronic tightness that then leads to inflammation when we get up and have to move around. The gluteus medius muscle that abducts the hip away from the body can also have a lot of strain in it if the hip abductors have become weak for any reason, and this may lead that tendon to become inflamed as well. Okay, the common denominator of all the three most common painful conditions in the hip is inflammation. Now let's return to that. What exactly is inflammation? Inflammation is a protein response, but the best way to think of inflammation is that it's like a fire. And there are two ways to put out a fire. One is to move away the fodder, right? You clear away the fodder and the fire dies down on its own. Now, how do we move away the fodder? Well, it can be surgical. For hip labral tears, hip arthroscopy can repair a torn hip labrum. And for hip osteoarthritis, surgical options can be hip arthroscopy, in which the hip is cleaned out in the case of mild or moderate arthritis, or it can be a partial or total hip replacement for more severe cases. But clearing away the fodder can also mean, and should also mean, exercises. In truth, most cases of hip pain can be resolved without surgery, and exercises are a major part of the non-surgical treatment. By stretching and strengthening the right muscles around the hip, and by doing it in the right way, you can unload the hip, which then allows the hip to rest and heal and ultimately stay healthy. Now, you can check out some of these exercises by going to our video on the best exercises for hip pain. The other way to put out a fire is with a fire hose, and this is generally anti-inflammatory medication. This can be oral medication in the form of over-the-counter NSAIDs like Advil or Aleve, or prescription NSAIDs. It can also be supplements such as curcumin or bromelain or tart cherries. Oral steroids for hip pain is a strong anti-inflammatory but ill-advised because the biggest risk in treating hip pain is developing something called avascular necrosis in the hip, which is a very bad problem, and oral steroids can contribute to this, and we'll talk about that in a moment. The best way to get medication into the hip joint is to inject it under either X-ray or ultrasound guidance. And there are three most common injectables that you can use in the hip. The most common is a steroid injection. Steroids, like we said, are strong anti-inflammatory medications, and they can work exceedingly well in hip arthritis and labral tears for short-term relief of inflammation and pain. Short-term is the key word. A good steroid injection, meaning one that works reasonably well, will often last for about 3 months. But, and this is an important point, the hip does not have the best blood supply, and repeated steroid injections can compromise that blood flow, which can lead to that thing we just mentioned, avascular necrosis. And this is where the hip joint lacks blood and the hip starts to die and collapse. This is not only a very painful problem, but it's a very difficult to treat problem should it develop, so we want to avoid it if at all possible. For this reason, one has to be careful and prudent when repeating steroid injections into the hip. Now, every case is different, and this needs to be a discussion between the patient and the treating doctor as to when and how many steroid injections to use. The second most common medication to inject into the hip is viscosupplementation. This involves a series of 1, 3, or 5 injections of what's essentially joint fluid. This goes under the trade names of either Synvisc, Euflexa, Hyalgan, Orthovisc. There's a lot of different products on the market that are available. Basically, these injections of viscosupplementation are replacing the joint fluid in the joint. Remember, this fluid then bathes the hip, lubricates it, nourishes it, reduces the inflammation. But because we're not replacing that all-important cartilage, which you'll recall is a sponge that holds the fluid inside the joint, the fluid gradually gets reabsorbed by the body. And so often the viscosupplementation, or you might call it hyaluronic acid injection series, have to be repeated in about 6 months. The advantage of putting the joint fluid into the hip is that what you're injecting is actually good for the hip, and it tends to work very well for both hip labral tears and arthritis. The disadvantage is that it can take a few weeks to see the results of the injections. So for patients in a lot of pain, you may want to start with something like a steroid injection, as those results start to occur within like a week, usually. Now, even if viscosupplementation injections are used, it's very important to follow up with the exercises to address the biomechanics and to start to tweak the biomechanics to unload the hip so the same stresses aren't going through the same parts in the hip joint, so that as the medications wear off, which they will, ideally the inflammation doesn't return. One more injectable that's gaining popularity for joint injections is ketorolac injections, or Toradol. This is basically a liquid Advil that's a strong anti-inflammatory. It's not bad for the hip joint and can work well, but also doesn't last as long and isn't as strong as a steroid injection is. And finally, regenerative medicine techniques are gaining in popularity for all of the mentioned hip pain problems. These regenerative techniques include PRP, which is a procedure where you aspirate the patient's blood. You use a centrifuge to spin down their platelets and growth factors, and then you inject that back into the pathologic site in order to help the body ideally start to heal itself. There are other techniques like prolotherapy, amniotic fluid injections, and other techniques. All of them have the common property of trying to get the body's innate healing mechanisms to the site of damage to ultimately heal itself. Now, one common problem is that insurance almost never covers any of these procedures, and this is because there's relatively little controlled research proving their efficacy. Now, that said, research is building. Personally, if they were a covered procedure, I would often recommend using PRP, particularly in lieu of steroid injections for the hip. However, regenerative medicine techniques are quite expensive. Usually they run between $750 and $3,000, depending on the particular doctor and the particular regenerative medicine technique being considered. So that's an important factor. Now, finally, for hip tendonitis, it's really best to focus on the exercises, as using the exercises are often very effective. Topical anti-inflammatories such as Voltaren gel or Flector patch, which are over-the-counter, or prescription Pensed, can also be helpful. These topical medicines are NSAIDs that diffuse directly through the skin to the underlying tendon. Whereas the hip joint is too deep for a topical medicine to really penetrate and diffuse down into the joint, tendons are relatively superficial, so the topical medication can really work quite well. Now, additionally, in recalcitrant cases, steroid injections under ultrasound guidance can be helpful, but care must be taken as steroids can weaken a tendon. Difficult cases of hip tendonitis are great candidates for regenerative medicine techniques, but again, like we mentioned, cost becomes a factor. You can also surgically debride a tendon, but this is rarely done, mostly because conservative measures are generally very effective for tendonitis around the hip. Okay, I hope you found this video on hip pain useful. I think we got in around 12 minutes. If you've enjoyed it and you've learned something, then please remember to like this video, subscribe to the channel, and tell a friend who might also enjoy it, because that's the way that we can spread good health information and achieve good health outcomes together. And as always, if you have any questions that you would like for me to answer in a future video, if you have any comments for me, you can reach me at drcooper@princetonsjc.com, or feel free to leave a comment in the comment section. Thank you very much.